Hello everyone, welcome to my YouTube channel. I'm Kira. I am a board certified health and wellness coach, a certified yoga and meditation instructor, and a certified dietary supplement specialist. If you haven't had a chance to poke around at this channel, please by all means go ahead and do so. We're going to be having a little brief discussion, except I'm the only one that's talking, about something that has come up quite a bit in my coaching practice, and I just really feel like it would be good to kind of address it in a way that is constructive and that helps people, because I'm coming across it quite a bit. And it's just basic vocabulary that is around natural health and natural medicine. So there seems to be some terms that are being used interchangeably, and I'd really like to just make sure that I'm putting out some clarification for people, because I can see that there's a lot of people that are getting really frustrated because they think they're looking for one thing and they're getting something else. So what it is, I think, is that in natural health, there's a term that gets used a lot, and that's holistic. And I feel like it's really important at this point to say holistic has nothing to do with natural. And I just want to leave that with you guys for 1 second, because I feel like most people think that if someone says they're holistic, whether that is a practitioner, whether that is a physician, whether that is a massage therapist, whatever, it doesn't matter. If they are telling you they're taking a holistic approach, that means they're taking a natural approach, and that's not true. And I'm going to explain it. I just want you to sit with that for a second, though, because everyone seems to think that holistic means natural, and that's not true. So holistic just means that you're taking a whole person approach. That's all it means. It doesn't have anything to do with your recommendations or treatments or anything like that. Holistic just means that you're not looking at one organ system at a time. And that is basically what the allopathic or contemporary medical system is based on. This is why we have specialists who are extremely specialized. We have gastrointestinal specialists, we have neurologists, we have surgeons, we even have surgeons who specialize in certain things, right? We have gastrointestinal surgeons, we have urology, we have all of these different categories, and these are very specialized into one organ system. That's it, right? They want to get specialized so they can focus on that one organ system, and they know everything about that organ system, and then they know all of the different chemical pharmaceuticals in order to help you. Contemporary physicians want to prescribe medications, or they want to cut it out. I mean, that's what they're good at. That's what they're trained to do. And I don't want to sound like I'm knocking on allopathic physicians. I'm not knocking on MDs. I'm just saying, like, this is what they're good at. This is what they do. And the modern medical system really has it down to you want to specialize in a particular organ system so that you know everything to do and you know how to treat it. That is the opposite of a holistic approach. A holistic approach is going to be looking at all of the things that could be influencing that condition, and then doing your best to try and take those different influences away to get to the root cause, right? And you'll hear that term used so many times, whether you're in natural medicine or whether you're in contemporary medicine, you're going to hear root cause a lot. So when you're looking for the root cause, you must take a holistic approach. Otherwise, you are just treating symptoms. And I feel like that is fairly common, but in the idea that when you're taking a holistic approach, you're utilizing natural things. That is not the case. You can have an allopathic physician, a primary care physician, let's just use primary care physician who takes a holistic approach to your treatment. They're not lying. They are MDs. They are trained in medicine, and they're skilled in medicine. But they take a holistic approach to that. So if you were to go to them and say, I'm having heartburn. I'm having heartburn regularly, and I don't know what to do about it. I would like to get this taken care of. They wouldn't just prescribe you a pill for acid reflux, let's say. They're not just going to put you on some kind of acid reducer. They're going to ask you about sleep. They're going to ask you about stress. They're going to ask you about your relationships. They're going to ask you about your life. Like, you know, what do you do? What are you a mom? Do you drive a lot? Like, they're going to be asking you about this type of stuff because they're taking a holistic approach to your treatment. Now, that has nothing to do with the treatment itself. Okay? So they are likely still going to prescribe you things for your symptoms, right? Your symptoms are, at that point, heartburn, indigestion, whatever, not sleeping well, and let's say anxiety, okay? They're going to prescribe you different medications for all of those three things. And they're still not lying. They're still taking a holistic approach. They're prescribing medications, but they are taking a holistic approach. There's nothing wrong with that. If that is what you're looking for, then that's great. That's what you're looking for. If you are looking for a natural approach and you go to your PCP who takes a holistic approach but wants to give you medications, and then you're getting frustrated with your PCP, that's not fair to your PCP. They're not lying to you. They are truly doing what they're telling you they do. So that brings me to something else, which is, like, these are all H words. So I feel like because they're all H words and they're used a lot in both natural and contemporary medicine, that people are getting confused. The other word that this is not used in contemporary medicine is homeopathy. And homeopathy is a super controversial topic. It is a whole modality into itself. It is an alternative care modality. There are people who have large amounts of education that are certified classical homeopaths who do amazing things. And don't let people tell you that that it's quackery. There's actually research studies that are showing amazing results with homeopathy. So whatever, they can say what they want to say about homeopathy. But here's the thing. Homeopathy isn't actually all that natural either. Homeopathy is a modality. It is an alternative care modality, but it doesn't have anything to do with nature or natural or any plants for that matter. Truly, homeopathic remedies are vibrational, and very rarely do they even have what you would think they have in them. And I'm going to have to do a whole discussion on homeopathy. Maybe I will have a classical homeopath on my YouTube channel at one point so that we can have a conversation about what homeopathy is and what it isn't, and go from there. But homeopathy doesn't mean natural either. Like it's not natural medicine. But you can have a holistic approach to homeopathy, and most classical homeopaths do take a holistic approach to their practice. And they'll be looking for something called a constitutional remedy. And in order to find that, they must take a holistic approach to their patients. So homeopathy is a totally different, separate ballgame, but also has nothing to do with nature, and nothing to do with a natural approach to medicine. So homeopathy is a modality of alternative care, but it is not an indicative word meaning natural, just like holistic does not imply natural, and nor does it mean natural. So then you have herbalists, and herbalists actually do use a lot of natural botanicals. They are using plants as medicine. They are using food as medicine. Clinical nutritionists are going to be doing that as well. Functional medicine practitioners are also going to be utilizing natural medicine. You've got naturopaths that are also doing that. NDs, not M, NDs. They are going to be utilizing a holistic, natural approach. Their treatments are going to be natural in their foundation. Now, some naturopaths will utilize homeopathy because homeopathy is actually quite useful. There are homeopathic remedies down in your Walmart. Zicam and arnica gel and all kinds of things that are over the counter. So there's a place for homeopathics. And I don't want to be pushing homeopathics either. I just want people to understand holistic does not indicate natural. Homeopathy does not indicate natural. Herbalists do utilize plants and botanicals in their approach, so they would be considered natural medicine, and they also use a holistic approach. They're often looking for constitutional herbs or remedies, and things like that. A traditional Chinese medicine practitioner is going to be utilizing a holistic approach. They are also going to be using different types of natural medicines, but some of those are not all that natural, or vegan for that matter, so please be aware of that. An acupuncturist is going to be utilizing a holistic approach, but they're not even really doing a lot with, I guess it depends on where you go, really, like with your acupuncturist, but if you're going to just somewhere that is offering acupuncture, most of the time they're not, recommending herbs and supplements unless you're going to an acupuncturist who also is certified in TCM, traditional Chinese medicine, which is possible. I had one on my channel, and if you haven't seen that interview, please by all means check it out. She is amazing, Molly Shaw. She's an amazing TCM practitioner and an acupuncturist. She absolutely takes a holistic and natural approach. But she doesn't have to. Traditional Chinese medicine does, and that's great. But, if she wanted to just focus on one aspect of the human body, I'm sure that would be, something she would do, and that would no longer be a holistic approach. But understanding that the modern medical system does not really push for a holistic approach and is actually kind of the opposite of that. They're not looking at the whole person per se. They are looking at the body system that is most affected by the symptom. That's all. It just takes the approach a little bit differently. But I really want people to understand that just because something's holistic does not infer natural in any way, shape, or form. So you can say you're holistic but you can still be practicing standard allopathic care and not be lying. Just knowing that those types of things are there. There's tons of vocabulary that seems to be getting interchanged with these two very different styles of health. And in my personal opinion, when you're talking about healthcare, you're talking about natural approaches. You're talking about a whole person approach. You're talking about the prevention room rather than the emergency room. And contemporary care is more of emergency to take care of something that's already a problem. Prevention is much, much easier than treatment. And people will probably argue with me and all of those things, but we know that 70% of our chronic lifestyle-associated illnesses can be prevented through the right types of management, which is where I come in. I am a health coach. I want to keep you healthy. I want to encourage you to do the things that keep you healthy. And when you start to see things are not on the right track, i.e. you're having symptoms, being able to help you prevent those from getting any worse and being able to curb it and come back to health. And there's a paradigm, there's a wellness paradigm, and I'm probably going to be doing several small courses on my website about those types of things, the wellness paradigm, and what the prevention room is. Because that's my background. I worked in emergency and critical care for almost 20 years. And emergency medical care is where medicine truly shines. It shines, right? If you cut your arm off, I'm not going to tell you to rub cayenne pepper on it. But, you know, there are things you can do that are not associated with allopathic care in order to prevent illness from occurring. There's a time and a place for all medicine. But we need to know, and we need to be clear on what we're talking about before we go looking for it. Otherwise, you're going to get frustrated, and you're really not going to know what to look for, and you're not going to understand. So, holistic, whole person approach. Homeopathy, totally separate, whole person approach, totally different modality. Herbalism, which is where you're going to get natural medicine, also in functional medicine practitioners, also in naturopaths, things like that. Clinical nutritionists are going to be able to do that. And they're also going to be taking a holistic approach. And then you have your allopathic physicians who are starting to take a more holistic approach to their treatment plans. I hope that clears up some things for people. If you have questions, concerns, comments, please, by all means, leave them in the comments. If you liked the video, like and subscribe. I'm going to sound like I'm plugging myself here, but that's fine. It helps me out. I will put a link to my website down in the description so that you can have a check out of that as well, learn a little bit more about me and what I do. And I am looking forward to having another video up shortly to bring you guys some more information that I think might be useful. Okay, have a great one. Bye.